so it, break the law.
Well, on that note, I get a motion to recredential Dr. Berke.
So,
Any discussion? All in favor?
Hi. Well, thank you all. I appreciate the, your trust in me. I hope I can live up to it.
Sorry, the first and the second.
First was me and
then second. And Tender. Thank you, Doctor. Okay, we are moving over to agreements to settle. So my agreements to settle page is deceptively short for you today. You'll see, I've got a little top paragraph here regarding public water supply violations. So as we've been talking about at previous meetings, you know, we wanted to work with our legal department to redraft our templates for our notices of violation and agreements to settle. So the good news is that we have done that. But they had not gone out with enough time to actually get enough agreements to settle to populate this page. So I don't want you to think that no violations have happened, because that is not, unfortunately, not the case. But we did, like I said, we reworked those documents and they have been sent out, but the agreement to settle date is not until the 19th, January 19th, because they have 10 days before the hearing to reply with those agreements to settle. So we don't have that nice wrapped up list for you. I am afraid that our next meetings list will be quite lengthy because it will include 2 meetings worth of lists. But that's why we don't have any public water supply violations for you today. And then the tobacco enforcement program violation was an incident where somebody sold to an individual under 21 years of age, and it was a first sale. So we offered them the minimum in the agreement to settle, which would be the $300 fine plus the $250 surcharge, and they signed that agreement to settle and submitted that minimum fee. Those ones are short, but then we can talk about the actual, I'm sorry, yeah.
What's the percentage of time that you send a 17-year-old in that they get sold?
Unfortunately, the percentage has definitely been increasing. And the number is also skewed because when they do sell to an underage individual, then we send underage individuals in more frequently within the next 3 years.
Sure.
So the number is skewed. I can definitely tell you the trend is increasing. I don't have a statistic for you.
Like a 1 in 4, or are they thwarted more often than they get through?
The majority do not sell to minors, definitely. But yeah, what we see is that, you know, and that's, like I said, that's the problem, is once they do sell, then they're on our list and you have to visit them more frequently.
Sure.
So, yeah. So sometimes that skews the numbers because they never sell again because we've scared them straight. But unfortunately, that's not.
Okay.
Yeah.
Thank you.
Mm-hmm. Okay, so then I'm sorry about that, I'm gonna just keep going, okay. So then the 2 cases for hearing officer recommendations. So the first one has a lot going on. Essentially, this is a situation where this facility, and I'll give you a brief timeline for this facility. The first sale happened in January of 2023. The proprietor had recently taken ownership of the business, and we got in there soon after it transferred, and they sold in 2023. At that time, they had signed an agreement to settle with a fine of the minimum $300 plus the $250 charge, and they had 2 points assigned to their license. In our follow-up inspection in February of 24, they sold again to a minor. So that got them to that 4-point level, which prompted us to send documentation to the state to move for their license to be suspended. That happened. They received when the state sends out those notices of suspension, our office gets copied on them. So we got copies of those notices of suspension in April and June of this year. And once those suspensions are issued, our staff is required to follow up within 3 months of them receiving those notices to make sure that they have gotten rid of all the product and they don't have anything in-house anymore and they're not selling anything and they're complying with the suspension. Unfortunately, when we visited them in August of 24, we found flavored vapes and Good Cup product, behind and near the register. So there wasn't a sale attempt because this was just our staff going in to make sure that they were complying with the suspension. So it was just us observing that they did have multiple product still in the facility. So we wrote it up as a violation, and they decided to come to hearing with legal representation. And so we presented our case, and the hearing officer made recommendations where she found that they did in fact have the product in-house and that, our citations were correct that they did in fact have product in-house in violation of their license suspension. So because this is them selling product while their license was suspended, the next step for them would be a fine that I can talk about what we would propose or what the options would be at least. But it's also a move to have us contact the state upon a Board of Health order to revoke their license altogether so that this facility, this operator cannot sell product again. And so that would certainly be, that was the hearing officer's recommendations, and it would be up to the Board of Health if you would like to move in that way. The hearing officer recommendations don't include anything about fines. So I did my homework for everybody. And breaking down the maximum fines that we would be able to inflict in this case. Public health law sets the fine of $2,500 for having product while operating under a under a suspended license. So that would be $2,500 plus the $250 surcharge that they require for everything. Because there was flavored vape in the product, we can charge a maximum of $100 per pack of flavored vape. Now, unfortunately, we don't have documentation in this hearing, this facts and findings that notes how many packs of vapes were present. So the most that we would, be comfortable charging would be one pack. So that would be $100 plus the $250 surcharge. And then for selling Good Cup product in a non-tobacco business without the proper signage, and since their license was suspended, they're considered a non-tobacco business. That would be $500 plus the $250 surcharge. So grand total of the maximum fine that we could set would be $850. I know you guys like to know what the maximum opportunity is for these things. So that would be your maximum would be $3,850 for a fine.
But the recommendation is that the permanent revocation of the license.
Yeah.
How permanent is permanent? Is there a chance that Mr. Gook can get his license back?
If people get creative with business names and licensing,
We've seen it.
yeah.
Still gonna cost them to.
Sure.
Right,
Yeah.
legal component, changing name and changing, if you're doing business as, tax ID number, all that, sure, they can probably do it.
That's gonna be onerous.
Get a shill to be yeah,
But he himself would be able to apply for another.
Correct.
yeah.
What, can I just ask what Gutka is?
Dr. Khan, would you like to explain, or I would be more than
I
happy to?
didn't, I never chewed it, but I can explain it. So it's smokeless tobacco, and it's usually mixed in with some spices, other flavors, grounded betel nut, and people just Far Eastern countries, India, Pakistan, Bangladesh, Laos, Cambodia, all Eastern Chinese. It's just habitual. They chew it. It just gives them a little kick because of the nicotine content. It's cultural, but the health risks are tremendous. Oral laryngeal cancer, addiction. Bob and I were talking about it before the meeting started because it's just something that's becoming prevalent here. So it's equally dangerous, if not more dangerous, than some of the other products that shouldn't be sold to anyone, especially minors.
Yeah, you are back.
You can order it online. You don't have to go to a shop. It's available. You can buy like 20 days of 20 packs for $15. So it's being sold online. You don't have to necessarily leave your house.
What was that number again?
3850.
3850.
Okay.
Yeah, I came up with a different number unless I missed one. I come up with 36. Was it 25 plus 250 surcharge plus 100?
Plus another
Yeah, but then
250
it's
surcharge.
There's
I
three
know.
Every
250.
violation gets a 250 surcharge.
Oh, okay.
Yeah,
So there's two 250 surcharges.
Three of them.
There's three of them. I'm
because the
sorry,
three
yeah.
violations
Okay.
are offered
Okay,
well under suspension, $100 for a pack of the flavored vape, and then the Gutka violation.
okay, I'm sorry.
That's, yeah, no, that's.
I know you did.
It would have been much more expensive if Austin had counted the flavored vapes, because I'm sure there were probably a bunch of.
Usually it is.
Yeah,
So it looks like we're looking at the option of $38.50 fine plus the permanent revocation of the respondent's license to sell cigarettes and tobacco products. Do we want to consider that as?
I'll make a motion to do that.
Motion?
Just one question, if he doesn't pay, what's the recourse?
well, that's something that we need to talk about it. I mean, the revocation will happen regardless of payment.
Right.
But yeah, the not paying is something that I've alluded to previously that we need to talk about because there's not a great rule in place. around it. Be very candid.
I second.
Any further discussion? All in favor of proceeding with the $3,850 fine plus the permanent revocation of the respondent's license?
Aye.
Any opposed?
You won't talk
Okay.
about the teeth problem.
Oh my
when
God, yeah.
I think you lost me at the beetle nut.
Yeah.
Yeah.
Just what you're chewing.
Isn't there lime in with it too as well?
All kinds.
Yeah. I know.
Creative.
Thought they mixed.
Put it between the lip and the gum, just like tobacco.
In Africa, it's Poland.
Yeah. It's just gives them energy, and they start when they just get it.
We have another.
So, yeah, so the next hearing is a little bit simpler in that they didn't show up for their hearing. We had offered an agreement to settle for this case. The agreement to settle that we offered was in consideration of what, their potential minimum fine would be. Which for this one, they sold a flavor vape to a minor. So the violations would be selling a tobacco product to a minor and then having the flavored vape. So there's the two violations. So the minimum that we would feel comfortable that we offered them in the agreement to settle was $900 fine. Again, they didn't choose to come in for their hearing. They chose not to sign the agreement to settle. So the hearing proceeded without them, and the hearing officer found that they did in fact sell a flavored vape for the minor, and recommended the 2 points on their license for that. And then they stuck with that $900 fine that was listed in the agreement to settle. However, if the board were so interested, they could increase that fine to $2,100. The maximum fine for the sale to the minor is $1,500 with the additional $250 surcharge. And then the $100 for the pack of flavored vape product in-house, plus the $250 surcharge, gets you to $2,100 for a maximum fine.
Does Smoketown have any history with you guys?
They don't have any,
Here.
they don't have any legal history with us. Yeah.
What's the but?
I know some 19 and 20-year-olds that buy from their regular vapes. Not personally, because I've seen them.
Right. So they have it on.
And they had it.
Austin is very strategic. This kid looks like he's 30.
My reasoning.
Yeah, he does.
He's a high school kid. We're not. And that's one of the things that people will try when they come to the hearings. They say, well, you use kids, you look too old. Like, honestly, we use the kids who are willing to do this. So it's not like we have a large pool of children to choose from.
But the dumb thing is, I go into Tops and buy beer.
Yeah.
You know, and this is so simple. They know that they have to ask for a driver's license. I mean, this is not rocket science.
Yeah.
Most of these places, they know they're illegally selling these flavored vapes, and the clerks they'll sell to anybody. They'll sell to anybody. I can walk in there and buy whatever I want.
Anyway,
I would propose that we impose the maximum fine allowed, because them not showing up for the hearing and
Mhm.
thinking, oh, okay, we'll pay 900
Yeah.
and get off the hook with 2 points. So that's my reasoning and thought process, that we should go for the maximum fine allowed.
And also just the cost of the county. We've talked about that before to have the hearing if they don't show up.
I would second your proposal, motion.
I think there's another issue here, which in the past, the fines have been so limited that it really, sorry, it's my call, I'm on call. But that people scoffed at it. The word will get around very quickly when you lay this down on a couple of people, because those community, I mean, they all know each other. Yeah.
It's already getting around because my coworker John has conversations with some of these folks
Yeah.
often, and it's getting around.
Oh,
Yeah,
yeah,
which is good.
You lay that
Which is
kind of
good.
hurt on, they're going to start to think about it.
All right, we have a motion on the table for the maximum fine of $2,100 and the 2 points being assessed. Any further discussion, comments? All in favor?
Aye.
Any opposed? Okay. I get the joy of putting my name on all these letters that go out.
You
Our
have,
names go on
personal
purpose.
protection. Personal protection.
Yeah.
Yeah, personal
We
protection.
did install a security system at the house.
I was gonna make a smart comment. If she just gets to sign the letters, we have to listen to the whine. on
Yeah,
the
I
end of
know.
the phone.
At least have them do follow-up inspection.
Okay, we are all through new business. So old business, sanitary code. I read in last month's minutes that there was a section that we were to be reviewing. Is that section? Article 4, section 3, part D, under private sewage. Did I get that right?
I think we voted on that.
Or did you already?
Yeah.
Oh,
also,
Yeah.
Okay.
Yeah.
It said be read and reviewed by the board and voted on at the January 2025 meeting.
Was there a separate section just because I get that mixed up? Need to verify. I brought the code with me.
We thought it was self-evident, so we.
Right.
Did you go for it?
Yeah.
Yeah, because this was about the variance for the second systems
On the same property that was
Right.
large enough to accommodate.
Right.
Yeah.
I'm just having to go with it and we'll just, Yeah.
Are there any other sanitary code assignments or readings that we need, that the board
Careful what
needs
you
to
ask
focus
for.
on?
Well, I think, it's sort of, big picture and we'll sort of carry on from where we just left off is, we did share some of the Erie County sanitary code, and we've been talking about how perhaps, another way to approach some of these tobacco selling facilities would be to get something into our sanitary code. So those conversations are still ongoing. We're still, having internal discussion about what that could look like and looking at examples from other communities to see, what has been successful or maybe what somebody's already done but missed a few sections. So we're looking into those things. But one of the things I did want to share with everybody, sort of as you're thinking about all of this tobacco stuff, this is a document that gets shared with retailers of what is supposed to happen in New York State. So as you guys are thinking about this and as we're preparing you for the conversations about, what we're thinking with sanitary code revisions, this just gives you a very bulleted list of the types of things that these retailers are made very well aware of. So, as we talk about issues, related to perhaps the location and the proximity of these shops as they relate to school facilities or, places where children are housed or whatever, however we want to think about wording that, that sort of topic. And then perhaps also even the bigger concept of if we did look at getting something into our sanitary code regarding issuing permits for these facilities on a local basis, in addition to what the state is requires from these shops, would there be an opportunity to say set a cap limit on how many of these retail establishments we would like in our communities? And how could we look at working on that number in a proactive way so that it is reduced from what it currently is?
And then also, there's the chip we have to play. People don't pay a fine. We're issuing a permit.
Because the way that the state is written as far as, licenses being issued and suspended and revoked, they have very specific language, but if we decide to put something into our sanitary code, we could also craft very specific language, that
Yeah,
perhaps closes some loopholes.
a lot. Yeah, well, as you know, I've been pushing that for about 9 years.
Yeah.
And very much overdue, really, for the county. Erie County's good, but they really put no limitations on it. All they did was create a licensing process without using it to its full ability, as a tool to limit location and numbers and things like that, which we can all do. And Steve and I have had this conversation a lot in the last few months. What are some reasonable things to put in it? And distance from schools, definitely. Density is something worth looking at, especially because it's a health equity issue. When you look at the density by neighborhood and certain types of neighborhood, definitely much greater density based on the demographics of the neighborhood. Very much targeted. And then looking at capping and reducing the numbers, which most places they'll pick like a percentage reduction every year, and then only grant permits if it falls below those caps, with the idea that you bring it down over time.
Do you guys have the capacity to implement and enforce? I mean, it depends, obviously, all the specifics, but if something like that were to be implemented, would it put too much on your plate?
Well, so part of this, we have to be at these shops anyways, because it's New York State required. Part of, if we wrote something into sanitary code, there would be an option for us to talk about a facility permit fee for these at the county level, which would help me in staffing costs. And then there's also, we've opened up conversations with some other enforcement agencies in the county, such as the DA's office, who are very concerned about untaxed items being sold in this county. And so we're looking at sort of ways to incorporate other agencies that are worried about the same umbrella picture, but from different angles. So we're looking at being able to spread that workload a little bit as well.
And both the laws allow for fees, reasonable fees to be set that would be reasonable for the type of enforcement that's going on. So, and the other thing that would be crucial to be in is to allow for inspection and confiscation. And then that would have to require some kind of partnership with law enforcement, not put it on the sanitarians. And the sheriff is all about it. We had a nice long talk, and I know Steve has been talking to some folks as well. That kind of partnership is going to be crucial.
And something that as we perhaps get closer to crafting the exact language on this, the fines associated with these actions are also going to, much like we've been doing with the water, to look at what it actually costs us versus what we're charging them. Once we confiscate product, that's great, but destroying this product, it's a hazardous material with the lithium, with the little batteries and all the gizmos and everything, so we can't just throw it in the garbage. So there's a disposal fee that is quite extensive depending on how much product we start confiscating. So all of those sorts of things would have to be taken into account as we were crafting a new
You
chapter.
can't just bring it to Cummins on their bulk
No.
waste.
There's models in place, and for the next 2 years, we've been collecting from the schools, and Roswell has a grant where they're analyzing all these vapes. And so Noel and his partner, they have basically, I just took a bag of 25 of them up to them yesterday. There's that opportunity to give them for free, other than the matter of somebody getting them to them, they'll even come and collect. And I think they said that that's good for at least another 2 years. They weren't sure how long they could do that, but we're getting a lot of interesting statistics from the analysis now by school.
And is there a policy in one of the counties in New York State that you would say, if I really like it for tobacco?
As far as,
Because we heard your thoughts on the Erie County.
yeah,
Is there a county that say, boy, that really looks good, their policy?
possibly Albany right now. I've been looking at that, trying to get the details. It's pretty new. I've talked to the Public Health Law Center, which is supposed to be keeping track of all these, and they really didn't have any great examples from New York yet, but I know, not necessarily at the county level, but there are some community ones. And California has taken this in some of their communities to actually set the number of retailers at 0. I mean, they have officially now, there are communities that have totally banned the sale of tobacco in any form in their community. So there are models out there that go to that extreme, and there's a movement within tobacco control to basically go to that kind of end game. It's an end game kind of thing. But I'm doing a little more searching because some things have happened over the last couple months, and it looks like Albany maybe has something decent.
Thank you.
But
Are we anticipating this new language to happen in 2025?
We would like to have something to present to you in draft form this year. Yes.
Be great. When? This was just as an FYI for us, right? We don't have
That's
to-
just for you guys. I mean, because it does, there is some bullets in there about maximum and minimum and maximum fines and the surcharge and just some of that general language to, help you guys, understand what the heck I'm talking about, but also I mean, to be honest, to show you how simple it is to do and comply with these things
If they want
if they wanted to. Yeah.
too much money, yeah.
So, yeah, so it's, yeah, just to wet your whistle a little bit on some of this enforcement opportunity.
Before we move on to water funds, can you just, you might want to make a note, Hannah, to just update
Yes.
your minutes.
Yep, I did. Yeah.
Okay, great. Okay, are we ready to move on to water funds? Is that
I
it for
think
sanitary?
so, unless Steve, can you guys have any other thoughts on sanitary code stuff? Yeah, so then the voting on the water fines is, I only printed a few sheets, but this was the information that we had provided at the last meeting. That we were interested in, setting baselines for these different water fines, depending on essentially the cost to the operator to, for them to comply with the requirement, and to hopefully having such lengthy agreement to settlement lists for you guys.
Are you happy with the numbers that are, we talked a little bit about it, but do they look satisfactory to you
I mean, I think.
for the time and effort and,
I think so.
Yeah.
both of you? Yeah.
Yeah. I mean, we put it together because again, we don't want, I would love all businesses to thrive in this community. And I recognize that sometimes stuff happens, people miss something here or there, mistakes get made. Every once in a while that happens, but these fines are, or they should represent the thought and effort that these people should be putting thought and effort into maintaining their water system so that they are not poisoning our community. So I don't think, they're excessive when you think about what.
Yeah, and it's
the
a gradual increase. It's not,
Right.
It is, and if you look at the statistics, we have 240 water supplies in the county we're responsible for. It's about the same 30 to 35 people all the time that are dropping the ball. So something like, 80% of them get it right 100% of the time. And the other 30% of them are lucky if they get it right 50% of the time.
Well, they might start getting it right more.
Well, except that brings to the fore the conversation that kind of started earlier about what do we do when they don't pay their fine? We have a situation like that right now. You folks put a fine against Chautauqua Lake Apartments and Motel. It was supposed to have been paid in mid to end of November, and it still hasn't been paid.
can it be tied to something like when people owe taxes to the county tax bill just came? And there are penalties and
Levies.
other
It would be
levies.
lovely if we
Can
could
it
do
be,
something
can
like
it be
that.
something similar that could be aligned with, because it is indeed a county issue?
It is.
And it's,
Leaving that in the property or something.
yeah, I mean, that's something that we, those are conversations that we wanted to make sure that we had your support for those things. But those are conversations that we're exploring, because we very much recognize that sometimes we feel like we're chasing our tails on these things.
Because, oh, by the way, they're on the list of the 32 fines we sent out on Monday.
Is there a public airing of this information as well?
It is available through the EPA's website. Very few people know that it's there or how to find it. It's not like the restaurants that has. Yeah.
Well, but with the
Or the
restaurants,
clickbait.
it's the same thing, because that's not information that we make available. It's shared with the state. There's a resource that a very tenacious reporter found and refers to regularly and then reports that out. We don't share that information directly.
Yeah.
That's a reporter going and grabbing that information and sharing it with the public.
But it's interesting that you brought that up, and that some of you who were on the last board, 23, we were dealing with a particular winery in the north portion of the county. And when that was aired on the newspaper, it improved, not greatly, but improved.
So it is something, and it's something actually that we've been looking for, going backwards a little bit, putting on our county website, listing the tobacco enforcement protection, the tobacco offenses, and creating and actually listing those, actions that have been taken and violations that have been cited, yeah. You know, I don't want to make our website just a list of all the big bad in the community. But, you know, we certainly recognize that unfortunately, sometimes that is the type of attention that reaches people.
We don't have a lot of ways to discipline this. I mean, you're working, clearly working on some with the fines and the taxes, but, you know, public shaming. It's another way to do it.
But the public should, I mean, definitely has a right to know too, because, you know, people get fined, don't pay, don't pay, don't pay. And then people are gonna wonder, how come we never knew?
Yeah. And like with the water supplies, the community water supplies, things like mobile home parks, as well as the municipalities and the big apartment houses, the nursing homes, senior living places, they all have to put out an annual water quality report every year. But who reads them? You know, buried in those 4 pages is a list of any violations they had the previous year, but
What's in that town?
Good. They should. We've been promoting annual reports.
living for done.
No, no, but we publish it right on the front of the website.
That's
every
great.
year, and I do get calls about it.
Yeah, we would love people to ask more questions.
We would, absolutely.
Yeah.
Well, maybe your department can come up with like, what steps do people have to fail before they get publicly acknowledged on the. Because it's not gonna be your, you know, first time or second time
No.
offender who's complying with what you told them to do. It's gonna be folks like what you just mentioned
Mhm.
who are still operating.
Yeah, make it easier for the paper.
Well, and a lot of our projects, you know, like a mobile home park, we could revoke a permit, but now we just put a couple hundred people out of where they can live.
Right.
You know, a restaurant, we could revoke a permit, that is doable. Though, you know, do we have the appetite for decreasing business in the county?
Employment.
But things like some of our worst compliers are the ag and markets facilities, the wineries, the Dollar Generals that we really have no teeth. So to be fair, the Dollar Generals, at least they are overseen by big corporate America, and we very much get a phone call when we send them the fine and they do pay. But you know, the local wineries we aren't that successful with getting their attention, let's put it that way,
Until they get publicly shamed.
until they get publicly shamed.
But
And
I
even
think
that
what
one-
Dr. Pender said, though, we as the Board of Health have some responsibility to put that information out there so the public can choose not to go to these places. 'Cause
Yeah.
it's- I mean, we'll get publicly shamed if it's found out and it wasn't.
All we need is one good outbreak and.
Exactly. And they'll say, what is that elf doing it?
So it's something that, we can certainly work on for next meeting, thinking about what that could look like for some of the different avenues that, you know, if that looks like us creating a press release after every Board of Health meeting to talk about what happened. And I mean, I know sometimes the reporters report out on specifically usually our facts and findings, bigger cases. But if that's something that you would like us to explore, we'd be happy to start thinking about that.
We need a mechanism to nip in the bud the people that are just constantly throwing us $100 a month because they didn't do what they were supposed to.
Right.
And that's partly why we put together this new fine schedule, but unfortunately, those are gonna be the same people that aren't gonna pay us.
Is everyone in agreement that they look at this before
Oh,
next
yeah.
meeting? We don't need
Absolutely.
anything else from us, right? Just a little direction.
Yeah.
Well, and also if you have a suggestion about a mechanism to get them to pay their
Yeah.
fine, you know, to tie it to something.
Yeah.
We do ask that you look at and approve this new fine schedule.
Yeah, this is our action right now,
Yeah.
right? Okay. Did everybody see it? There were a few floating around.
So do you think this is punitive enough where they won't repeat?
It is way more punitive than we have been.
Yeah.
Everything has been a flat $100 fine to this point. So it's a step in the right direction. Should it be more?
We can always
We got-
review
It
it.
can
a
always
year
go up,
after,
it can
yeah.
get reviewed every year.
I was just thinking if they violate it 6 times, it seems to be, it should,
I mean, we're hoping it's not gonna get there.
Yeah.
But,
Here we
but
go.
yeah, but that's why, and that's part of why we talked about making these fine, schedules appendixes or appendices rather than meat of the sanitary code, so they could be easily revised.
yeah,
On an annual
Whenever.
basis.
no, I understand that.
Is there a motion?
In this, I'm sorry, one more thing. So this is also just, this is us being able to have a starting point when we offer an agreement to settle. If for some reason these folks decide to come in for a hearing and it comes to the Board of Health for an order and you guys think that the fines need to be higher at that point, then you're always at liberty to do that. So like I said, this document is just to give us a better base starting point for agreements to settle and so forth.
So at least we're covering our costs.
It's not a maximum. This
No.
is just-
No, no.
Okay.
Motion to move the new water fine schedule as presented.
Do I have a second?
A second.
Frank Hairbrake. Any comments, discussion? All in favor?
Aye.
Any opposed? Okay. All right. We have a director's report next. I think it's a separate handout. Are you stepping in?
I think
and
Lacey
Lacey-
mentioned Jessica has the honor.
Yeah.
Me to keep talking tonight. So, yeah, and again, she apologizes. She woke up feeling under the weather. She was hoping to power nap and make it to Board of Health, but she decided in the interest of community health to just stay home. So she has tasked me with this. So, the top new thing actually does directly relate to my division. I think we've talked a little bit about lead rental registry coming up. It's the new mandated program from the state where we will be going and inspecting properties that have 2 or more units that are rental properties within the 14701 zip code. Obviously, it will make a lot more sense if we have a Jamestown home base from which to base that staff out of. So we have procured some space in City Hall, and it is currently being outfitted with new desks and the proper electric and networking and all of that jazz. So we're hoping to get new staff brought on for the lead rental registry program, new technicians, new clerical staff, et cetera. And then they will be housed in that Jamestown space. And we're hoping to be in there early mid-February actually and start using that space. The staff haven't been hired to fully flesh out that program yet. Those inspections are mandated to start in November is the current timeline that we've been given. But we are hoping to get them on as soon as possible so that we can get them training, experience, the certifications they'll need to function in that program. The second bullet point here is a New York State Performance Incentive Program Award. Is that the last P? Okay. So every year, the state sort of gives us a homework option to do a little bit extra to focus on a specific area and to think about how this specific area fits in our community, what we can do in our community to sort of build out and improve for the future. The last award was relating to improving green space and improving access to green space in the interest of reducing some of the chronic disease problems that we have in the community. So we did our homework well, and we received, I think she said roughly $23,000 as a result of our participation with that program. And so that money is just used for, the health department, the goal of sort of, there's no, as I understand it, no specific ties about what exactly that money has to be used for, but the idea is that we'll use it to promote what we have just sort of built out as improvements for the future. And Lacey recently went through the county ledge, and Matt Hanley was reappointed to the Board of Health. he's not here for us to blow about, so we'll have to blow about it next time, I guess. But that happened and he was officially reappointed. There are some interesting new state laws regarding the medical license or medical professional licenses that can be used to fill Board of Health member positions. And Lacey just kind of wanted to point out, we are blessed that we have plenty of medical folks on our Board of Health. You know, some of the other smaller communities just don't have as many options. So the certifications have sort of been broadened about who qualifies as a medical professional that they can incorporate in their Board of Health. Okay. Updates. The pediatric dental services, if you want to jump in at any point, please feel free. You know, this has been us with an ongoing conversation about the UB dental ban and, you know, the loss of those valuable services and what we can do to prepare for the loss of those services and, you know, come up with something to replace that loss. So Lacey wants to mention, you know, they're working on creating that framework for a draft proposal to the Western and Central New York Health Foundation. They're meeting with leadership at ECC to prepare to sort of think about designating a lead agency and finalizing a proposal so that they can, you know, have something ready to go for actually getting something in place in the community. The three priority areas that they are focused on right now would be infrastructure, you know, specifically, what does this service look like? Is it still a mobile unit or is it something more solitary? Is it a pop-up throughout the community as, you know, as areas of need are identified, what does that look like? And then workforce development and recruitment. You've obviously talked about this a fair amount. It sounds like there's a potential with the Monroe College.
Hygiene program.
Yep.
Oh, yeah.
Mhm.
And then, you know, obviously, all of these things require state approval and transfers and all of that sort of facilitation for these new sort of developments and investments. So just to let everybody know, things are still in progress. Nobody's forgotten about these things. There's still work being done. If you have anything else that you'd like to add, please.
I think that's a great summary.
Okay.
Quite interesting, because yesterday I was at the UB Dental School all day, and the medical students brought this up, the dental students, how much they missed the rotations through the dental van, and that it's hard for them to get the time that they need now without that, and wondered if anything was being done.
Interesting, yeah.
Being talked about.
Yeah, it's really disappointing though. I mean, I feel like the communication, we really got kind of pushed, shuffled right aside. So that's just, I don't know how they're utilizing. They have 2 mobile units. I don't know how they're utilizing them, but.
And I guess not like they used to, because the dental students were saying they're not getting the opportunities.
Right. Really disappointing.
Yeah.
So moving on, if we're ready,
They do.
strategic planning and 2025 budget preparations. So Lacey wants to highlight that, you know, our staff in-house that we have here at Chautauqua Health Department, you know, we're the people who are here are happy to be here. We've you know, worked with folks. We've improved staff retention. You know, we've worked on some sort of, you know, different internal programs and things to, you know, to help staff be more connected with each other, with among the divisions, and, you know, just sort of provide a happier, healthier workplace for everybody to be. We do currently have 17 vacancies. And, you know, those are a variety of positions from clerical to nursing and everything in between. So there is certainly opportunity for more people to join our team, and we would love to have them.
Do those include new positions open, like the lead rental
I
registry?
believe those do include the new, because
That would be 6 of them.
I have 6 positions for lead rental registry alone. that are brand new positions that are being created for that program. So they're going through the HR process. And we're waiting for those sort of determinations and things.
So the 17 isn't that bad because it's. six
Correct, yeah,
brand new
because
ones.
some of that is growth. And
Yeah.
yeah, and I'm sorry, I should also recognize that some of that is also with the consolidation of the fiscal units and the purchasing units and some of the different arrangements that have happened over the past couple of years at the county level. A couple of those positions are to enable our department to do some of the work that those fiscal folks had been doing previously, but has been given back to our department to handle internally. So we have, we've taken ownership over, things like purchasing and some of the payroll requirements and those sorts of things. And as consolidation occurred, those positions sort of stayed with their department headings of fiscal or purchasing. And so we've had to sort of create new positions to do what we need to do. And some of those vacancies, are retirements and things. So it's, it's not just folks running away. Yeah, and then, the lead rental registry positions, like I said, those are brand new positions. So they're working through the HR process. And then we hope that they'll move soon because I do have a few folks who are very interested in those positions. I just need them to get through the HR process and post it. And then funding updates. This is related to the public health infrastructure grant that we have. Unfortunately, the state doesn't always move as quickly as we would like to regarding approving budgets and things. So we did just get year 2 approved. We are pretty much done with year 2. But it is approved, so they liked what we had proposed, and it's good because we already spent the money in that way. And so now we're working on finalizing the year 3 budget, and then in that year 3 budget or submission, in that year 3 submission will include two of those staffing positions. One related to a grant coordinator position who will hopefully help us deal with all of the grant administrative level sorts of oversight things that all of these different grants throw at us with all of their different timeframes and whatnot that have to be satisfied in the claims and the paperwork, and helping be that link between our department and the larger county departments that need to be involved in those grant process fiscal activities. And then the other position is related to a project manager, I think is the title. And that position, is a full-time position that will help us stay connected with the, substance abuse and awareness, and all of the tangents that go along with those issues. So those are the 2 positions. We included them in that public health infrastructure grant. The language of that grant required that if we were going to fund a position, they had to be brand new positions. They couldn't be existing positions that we already had or already had identified a need for. So these were new positions. I think that's everything. Any questions?
How's the intern, is it intern? Am I using the right? There was 2.
The fellows.
Oh, the
Fellows.
Yeah.
I knew.
No, you sent me down because I have a beach intern in the summer, and I was like, it's too early to talk about beach intern. No, they're doing great. I mean, they're all super eager to learn. They're all super eager to, see other programs and see how it all fits together. We have Rita sort of housed in our environmental health division, and she's just a sponge, and she loves it. And it's nice to see a young person's perspective on some of these things, because she'll ask questions and I'll be like, yeah, I haven't thought about that in years. This is just how we do it. So, it's nice having those young people in-house too, because it helps remind us sometimes about the things that maybe we should be paying attention to or revisiting from the start kind of stuff. So, yeah.
That's good.
So I love,
pipeline development.
Yeah, it is. It's
Yeah.
great.
yeah, absolutely, and that also, yeah.
And there's no room for, we're full on that. We don't, or we,
Yeah, all of those fellowship opportunities are filled.
Yeah.
Yes. Yeah. And they're here for 2 years with us, so,
it's great.
yeah, they're a great
They're
bunch.
wonderful assets.
Yeah.
Will they be given an opportunity to, for another, job opportunity here? Or,
I mean, if they're interested in the positions that we have as they open and they're qualified and all of the civil service boxes can get checked, provided that, I mean, I can only speak for myself, but I would be happy to have any of them on our staff full-time. This depends. I think the nice thing about this fellowship is that they are, for the most part, very young and, they're just getting into it. So I know, like with our Rita in particular, she mentioned that she came in thinking it was going to be one thing. And now that she's in it, she kind of sees this other avenue that she'd rather explore more, which is good and bad, we're helping sort of guide them and explain to them. And part of it, quite honestly, is just explaining what it's like to work in government and all of the check boxes and layers and
Different
things that
But
are
don't scare them.
included in that. So helping them understand the opportunities and limitations that we have to abide by.
Down low.
Any other questions for our stand-in director tonight? Okay. All right, next up, presentation on settlement funds. Is that?
Steve.
That is you, Steve.
Oh, that's me. I didn't know it was, maybe I could have changed the slide deck. Talking about something else. Well, I don't have too much to say particular to the opioid settlement fund. And by the way, I should introduce myself in case anyone. Steve Kilburn, I work here. The screen indicates addressing addiction. They're related matters from a public health point of view. But to segue using the opioid settlement funds, we, like other counties across the nation, have been awarded for the different fashions monies that were obtained through lawsuits, pharmaceutical companies, et cetera. In fact, they keep coming. I think you guys
Yeah, we talked about.
yesterday
Yeah.
addressed another one. So, we recognize, as you'll see in a moment, how the impact of opioid addiction has taken a toll. Familiar to some degree with that. But we have some news that I think will give us some encouragement about the directions that things are headed. So, my role is, again, from a public health point of view, working with lots and lots and lots of partners, internally with our county government, but in the community across the county. And we have, and I'm not by any means going through all of this, I just wanted to make reference to the fact that we operate around these 7 priorities that give a kind of structure to the things that we're trying to do. And addiction is so expansive and really touches so many areas that we want to keep all of these things in front of us and probably more, actually. But I did want to bring an update, happily, to say that there's been some really tremendous progress in our county. I handed it, advance it. So the first, and this is the only one of those 7 items that I'm going to really reference, although I'm happy to take questions on all of them. But we had set, I had really kind of arbitrarily, frankly, set a goal of the 2 years, 2024 and 2025, of reducing our overdose fatalities by 33% and non-fatal overdoses by 25% over the 2 years ending this year. And that I would still contend was a pretty ambitious goal insofar as the trends have frankly only been going up. But, you want to see that change. So here's where we stand. And that is the historic data that you can't really see, but goes back to 2015. These are overdose fatalities, annual overdose fatalities in our county. And that goes up to 2023 on the graph you're looking at. So that was the highest year on record. And we set a goal, as I said, a 33% reduction would have turned the graph over 2024 and 2025 to look like this. Well, here's what it does look like. That's where we ended 2024. So we have exceeded even the ambitious goal set for next year and have a 52% reduction year over year number of overdose fatalities. So, it's not often, especially for many years, that talking about addiction, you can say anything that's, we're talking about deaths still. There are 29 deaths in the county, so we recognize this as a celebration. But it's clearly progress, and it's rare, like I said.
I have a question.
Yes, sir.
Did we just kill off most of the high-end users?
Well, the obvious question is what accounts for this dramatic decrease?
Mhm.
And you'll hear, if you haven't already, press reports of national trends down, statewide trends down, although I will say that 52% is ahead of the curve. But in that context of national and state trends, there is a lot of discussion about, well, what accounts for this? And Dr. Berke's point, one of the most sort of typify it, but one of the most unhappy, let's say, explanations is that it's kind of run its course. For two reasons, I'm not prepared to say that that's been the whole explanation. One is, I think the nature of addiction is such that to think it's run its course is odd. Secondly, I think vis-a-vis some of the other communities, including our big northern neighbor, our trend is still far more decreased than they might experience. I think the press release that went out was like 14% maybe decline in Berke County year over year. So, I know that doesn't completely dispel the idea that part of this is it's running its course, but I don't think that in and of itself can account for it.
I think a lot of the data, and it's interesting that Bob brought this question up. Some of this data was presented a while back at the board meeting, not the exact number. And there's a lot of national discussion at this too.
Yes.
There are a lot of communities where there have been declined. And I think it has to do with the awareness, Narcan availability. And that is a huge factor.
But
To some
also,
extent, it may
There's one
count.
other thing. The sellers have figured out that they were killing their buyers. And so they've changed the product so that it is not as lethal. And I mean, that's another possibility.
It is.
And
It
what's the other measure you have to look at is, and we have no way of knowing this.
Well, it is.
How many users are there out there? Are the same number of people using? The same percentage of the population using, but fewer of them dying? Because then all we've done is made it safer to use.
It is a possibility. There was a recent article published in, I think, Wall Street Journal, in the health section, and the product that's coming across the Mexican border.
Mhm.
It's not a medical term, but it's a lot safer.
Mhm.
Because the sellers, and to your
They
point,
were
have
killing their
figured out.
buyers.
Yeah.
Yes, of course they were.
So that's an element there.
Well,
too.
yeah, again, with addiction complications or the complexities, let's call it, really great. If the enforcement at the border has been lax, then there is less need to concentrate the product. And so that alone can account for a change in the supply. And there is good reasons. I'm told I don't have any local data, but that your point, that the supply has changed and it's become, if you will, safer.
Well, we also had a few years ago a significant transition from mostly heroin to now almost all fentanyl. And that transition, I think, created a huge increase. And now you have patients out there who have a tolerance to that product. If we look at the cohort of patients just within our county jail, I can tell you the demand for services has not gone down over the last year or two. In fact, it's probably gone up. So the demand for service is still out there. And the other thing that we know from a physician standpoint, more physicians are more comfortable treating patients with medication assisted treatment. 3, 4, 5 years ago, that was not the case. I mean, very few emergency physicians and emergency departments were treating. Now almost all of them are. Very few primary care physicians were treating. It was the exception, not the rule. So I think more and more people are being appropriately treated.
And yeah, the waiver change.
Yeah, that was a
helped.
big, yeah.
Well, and I can say as a parent of a college student, the whole stigmatism of having Narcan available and knowing who has Narcan available is not there.
Yeah, I think we reached on that front, which I would account, of course, as one of the major contributors, but I wouldn't contend it's the only one. But I do think there's almost a kind of a tipping point where I think we reached with stigma, et cetera. And I can concur anecdotally, being in public places where Narcan is being distributed, et cetera. The conversations have changed considerably. People come and ask for it. First of all, they're familiar with what it is. They'll need an explanation nearly as often. And that kind of like recoiling, like, oh, I don't want that. That's less frequent. So we, as a county, I mean, I can account for 7,000 plus. That's a bare minimum, really. There'd be more that I can't account for, but of Narcan kits annually for 2024 being distributed. So that's a lot. That's another tipping point. It's being available in a lot more places. By the way, in addition to the decrease, 50-some% decrease in fatal overdoses, it's much more difficult to track non-fatal overdoses for a few reasons. Not least of all,
We don't know about more.
they don't know what we don't know, right? They don't get reported. But even that would contend, I think, that the Narcan distribution is successful. But we've seen some data from EMS that something like a 25%, 20-ish, mid-20s reduction in calls for non-fatal overdoses are happening. Again, what that means is a little bit hard to discern. But this fact, I think, should be a significant point to public health. That overdoses have been, for at least the past few years, the #1 cause of death for county residents under the age of 60. And that cause of death has fallen by over 50% in a single year. So that is, for whatever reason, an encouragement. And frankly, gives, I think, some more bandwidth to start to think about the other addictions and other, which I want to make mention of in a moment, but including tobacco, which, as far as the deadliness of any addiction, nicotine by far is the deadliest drug in America. And frankly, alcohol would be a second. Legality doesn't really help.
So nationwide, what's the average decrease in number of deaths?
Well, so the CDC, we're far more prompt with our data. So nobody's talking about the whole year, but I think the national rates are in like the maybe low teens.
Right, and I think that your problem is your N is too small. You're dealing with a very, very small sample, while Erie County is large enough that their sample is probably more reliable with respect to what's really going on. And not to, hey, 30 that's terrific, whatever it is, but the number of your total denominator is too small.
Well,
And, I mean, that's just no big deal. It's just, if you look at Erie County, it's probably more representative of what's going on because it's such a large population. But anyway,
it is good news. And I mean, admittedly, I guess my reply would be, well, the last 3 years, I mean, this has fallen off the cliff in terms of the numbers. Maybe we have 50% where you know, it's not statistically significant, blah, 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 but I don't think it's a blip. I mean, it's a significant trend.
No
change.
question.
Yeah. What else would I put up on? Didn't want to take too much time. Oh, just a few other changes in terms of the drug supply, because I think, again, we don't want to be fighting, you know, 3-year ago battle, 2020 battles. Fentanyl presence, it's still the main killer, of course, and it's present in majority of the deaths, but it's actually coming down in its prevalence. These are the toxicologies of the disease. And cocaine has actually come down this past year. That may or may not be of significance. But this next point is the one that really needs to be underscored. And that is, while we still have to keep our eye on the ball with fentanyl, we have, and this has been for a few years going on, but methamphetamine now has really become a significant public health problem, as well as public safety and a host of other ways to say that. In fact, now it is slightly more common that somebody would die with a stimulant in their system than with fentanyl.
Yeah, and we've actually seen recent cases of a pure methamphetamine overdose
Yes.
with no
No fentanyl.
opioid in their system. So
The
we
other-
have not seen that over the last couple of years.
The
We're
other
seeing that as
problem
more
with the
prevalent.
methamphetamine is these people are dangerous.
Yeah.
The opiate users are usually, they're either just trying to stay from going into withdrawal or they're just nodding off. These people can be really dangerous. And then you have the mix of these psychotic, are they schizophrenic or is it a methamphetamine psychosis? And they become very unpredictable and very difficult to deal with.
They're very high utilizers of the medical system.
Yeah.
Inpatient,
Yep.
medical care, inpatient, behavioral health, not to mention all the outpatient services. It's a huge public health problem.
And so I would say, in light of the fact that, again, not to say opioid overdoses are, you know, a historic, you know, interest, they're still a current concern, but to the points that you're just making, the significance and the need for addressing methamphetamine use in our communities is, well, it's just a recurring theme in every opportunity I have to say that if we think that fentanyl, which of course has rightly been a focus of attention, is the only issue, we're missing it entirely because methamphetamine is taking a toll on every level, from, of course, the personal, families, to our systems. And the challenge, excuse me, of course, is that methamphetamine doesn't have a buprenorphine, methadone to treat it. Now, there are behavioral treatments that have been studied, and they're evidence-based, but it's a very different kind of an approach, which I'm hoping that we can start to see more utilization of. We don't have any in our county, to be candid, and that's a real problem. So once again, as the overdose rates come down, and I think there's more capacity to really ring the bell on some of the other needs that we have in the community, I think you'll hear more about that. So looking forward, and by the way, I want to say that that strategic framework, which is outlined up there, is a lot more detail. You're welcome to these. Thankfully, after a year, they've almost become a little outdated, so I put an update in the middle of it. But and if there aren't enough, I'm happy to email electronic copy. We look forward to reducing the number of overdose deaths even more in the year ahead, but also, as we have been, continuing to address these other priorities. Prevention, of course, and back to the opioid settlement funds. Among the other uses of it is a pretty significant investment with Prevention Works to expand their, specifically in the Dunkirk school system. So they'll be expanding work that they do there, as well as, of course, school. Lots of other items there. I take more time than I'm welcome to, but I'm happy to talk more about it. I can talk all night about it or answer any questions.
Steve, I think you've done a remarkable job in this arena. You know, I've had the the pleasure of watching Steve in action the last couple of years, monthly at the Chautauqua Substance Abuse Response Partnership meetings. And Steve has a wonderful ability to bring all the partners together at the same table and get everybody talking together. And I think that's a big part of the success here. So congratulations, Steve. I think that's a huge deal for that partnership.
Thank you.
Yeah.
The tragedy is that we are seeing decreased life expectancy for the first time in a long, long time. And it's because of the years of productive life lost by this cohort of individuals dying in their teens, 20s, 30s, 40s. You know, it's just tragic.
We'll see that ramification play out now over the next 15, 20 years.
The biggest concern I have is the fact that youth initiation has gone from conventional cigarettes to vaping, and they're getting 50 times more nicotine on their developing brains, which is
Yep.
setting them up for future addiction.
Yep.
I really believe we have an epidemic in the making because of vaping, because of the high doses of nicotine that they're getting compared to traditionally they would smoke a couple cigarettes once in a while, but now they're
puffing all day and
they're getting the equivalent of 20 packs of cigarettes in a couple of days, you know, the equivalent nicotine.
And our challenges, we used to be able to talk to these young people about their smoking and cessation and referral and patch and medication. The vaping population, the younger kids, teenagers, they don't want to hear about it. They're like, no.
Because they've been sold the bill of goods. This is a safer alternative.
Plus
their parents are
the
buying them
addiction
for
level
them.
is high, so.
we need a nicotine blocker.
Yes.
We'll get those injections all day long.
Yeah.
They can puff and they won't get it.
Yeah.
Wow. Okay, it looks like we have a final reminder. I think we all got emails this past week with our ethics training and our financial disclosure filings. They take a little time.
No.
Are there any other things you wanted to remind us of on those? I clicked on my link and I was sad to see that my answers from the previous year did not carry forward. So you have to go in and read,
I've been trying to do that for
plug
20
it
years.
in.
Can we write unchanged?
Yeah.
I saw that written,
Same.
some or
Same.
same, yeah.
Ditto.
I did ask Hannah for my last year's, so at least you can copy it.
Yeah, I saved
Especially
mine.
for
I
all the
print it out and then I
print
type
it
it
out.
all in again. The only thing that changed is my children are a year older. Oh, there you go. What's the due date on that, by the way? What's it? April?
It's like April since
I want to say it's about tax
April
day.
15th.
Yeah.
All right, so we have one more meeting.
I'll send an updated email. It's my first time around the board with this, so I'll get that information.
Just thinking I haven't been poked yet this year.
Is there a different date of the disclosure form and the training? Or the training is
Training is, ethics training is different, yeah.
different? Yeah.
It's a PowerPoint.
Yes, it's about six different.
From what I understand, again,
I don't
this is
know.
the first time aiding through.
Sign it off their
Yeah, it's kind of like a PowerPoint. I believe there's some questions, if you remember,
we read
but I think it's
everything.
overall.
Yeah.
Yeah.
And there's a way to certify or
Yes.
say that we.
I'll be working
completed
with
it.
you and Lance will be working with you through the ethics board and we will make sure that everything.
Good.
File is
Just how many blocks and
And I will send an email out with updates and.
So I don't have to do it again right away since I just did it.
I don't believe so.
No,
but-
but I haven't seen.
I will not
anything.
confirm or deny, but I don't think so. If you were emailed, then you should be safe.
Right.
Yes.
I haven't seen it.
Yes.
And I just did it right.
Yes, because you just started. Yeah, I think we'll be all right.
I don't think so.
Oh,
I'm
no,
gonna
no.
contradict you.
I think it's
Nobody was
Like,
there. because they
every
didn't see stuff.
year, and yeah, you.
Oh, no matter what.
Yeah.
Oh, sorry, I thought I had the news for you.
I haven't gotten to it.
I'll double check.
Yeah.
But it's nice of you to ask. You could have just been like,
Yeah.
I didn't get.
I would too, but I got promoted in September and had to do it again in December. So For January.
You're like, let's get that.
Yeah.
See everybody in here. Marty, can I have a motion to,
And then there's the double
Adjourn.
for those notifications, which I get.
we don't need a second for the adjournment.
No, I read that.
Yeah.
Nice
to see everybody.
Keep the heads above water, you know?
Where's the button on the?
Yeah.
We're looking for some additional.